Every day in the UK, women face inequality at home, at work, in politics, and in public life. Although women make up 50% of the population, they're only 29% of MPs, 25% of judges, and 24% of FTSE 100 directors. This means that in politics and in the law and in business, women's voices are not getting heard. Working women earn 81p for every pound a man earns, and at the current rate, it will be 70 years before that gap eventually closes. Women still occupy the lowest paid jobs. 3/4 of the people who've done minimum wage jobs in the last 10 years are women. In the UK, around 1.2 million women suffer domestic abuse a year. Every day, there are 250 rapes or attempted rapes. In the UK, progress has stalled in the early 2000s, with a substantial difference remaining in pay, hours, and representation in top jobs. Men are consistently the top earners. Of course, women have lower labour market attachment as compared to men. But the same conclusions are drawn if we look only at statistics related to full-time, full-year workers only. Globally, women have been hit hardest by COVID-19 lockdowns. COVID-19 has amplified existing inequalities between men and women concerning employment and caring responsibilities. We know that intervention is required to ensure that those differential impacts don't erode the hard-won gains by women over the last few decades. While our focus today is on women battling for equality with men, still not all women are deemed to be equal with each other. When we consider race and ethnicity, the statistics on gender disparity becomes even more startling. And so I wish to highlight an important facet that intersect the experiences of women: race. I must be clear here, I do not wish to imply that there is a hierarchy of oppression, rather that the fact that some face multiple oppression must be acknowledged. The interconnection of being Black and female is labeled as double jeopardy, suggesting that this dual status yields double discrimination in terms of racism and sexism in the workplace. But research suggests that race often overrides gender, implying that Black women are likely to experience racial rather than gender discrimination. Similarly, the achievements of Black women in Britain are often overlooked, and when they are acknowledged, are associated with Black history rather than women's history. So as we discuss International Women's Day, it's important that we do this in an inclusive way and acknowledge the struggles and achievements of all women. If we're really committed to creating fair, diverse, and inclusive workplaces, we need everyone to work towards actively and intentionally addressing the lack of representation of Black women leaders in education and influential positions across all sectors in society. Women from minority groups experience disadvantages across employment sectors. This is particularly evident in academia, where representation is incredibly low. The increase in precarious short-term and zero-hour contract also affects racialized employees more than it does white employees, with Black women more affected than other ethnic groups. Black women are also visibly underrepresented across all areas of work, from doctors and consultants in the NHS to academia, where the first Black female history professor was appointed only in 2018. Black women, regardless of whether they are from the UK or elsewhere, have the lowest probabilities of being top earners. And UK-born Black women are the most underrepresented in the top quartile of incomes as compared to all other women and men. The government's race disparity audit shows that while the employment rate is higher for men than women in every ethnic group, the gap between men and women is biggest in the combined Pakistani and Bangladeshi ethnic group, where 73% of men and only 39% of women are employed. In health, racialized women experience higher maternal mortality rates, experience poor outcomes in care, and at an increased risk of having preterm birth or stillbirth, and have a high mortality rate and incidences of poor outcomes for those suffering with cancer. A report on the experience of Black and Asian and minority ethnic women in criminal justice system found that they have less support inside prison, are subject to racial and religious discrimination from other prisoners and staff, and face an elevated stigma of imprisonment from their own communities. Prison Reform Trust found that racialized women are more likely to be charged and imprisoned with minor offenses such as TV license evasion, non-attendance of children at schools, or theft, often related to financial difficulties and looking after children. Black Southwest Network acknowledges the enormous contribution Black women have made by undertaking crucial roles in society, and the tremendous value they bring to the economy prior to and during the pandemic. It's time to see Black women as the community wealth creators, high achievers, and entrepreneurs. Time to provide support more actively than ever in carving out a meaningful recovery. Time to involve the underserved and underestimated to achieve a different kind of growth towards the kind of ethical and progressive society we crave. A key aspect of BSWN's current focus is on pragmatic solutions to support Black, Asian, and minority ethnic women in business. Our tested model has recently proven its effectiveness with the delivery of Women in Business, a business startup program in partnership with NatWest that created targeted support and opportunities for Black and Asian women in business. The program delivered 130 hours of support to 15 business women. Business like Box, founded by Catherine Lewis, a dual heritage woman born and raised in Bristol. Box delivers culturally appropriate tropical fruit and vegetable boxes consisting of items such as plantain, yam, okra, and cassava. Being part of BSWN's Women in Business cohort, Catherine Lewis accessed a series of workshops and one-to-one mentoring, ranging from the areas of business administration, planning, finance, branding, self-care, and more. The program provided Catherine support to pursue her plans to grow her business and to expand regionally. Our economic recovery strategy needs to place inclusive economic development at its core by catalyzing inclusion to implement a shared agenda that expands opportunity. Recovery must include the voices of those too often left out of the design of initiatives developed to help them. To truly build resilience, reduce the gender pay gap, reduce gender inequality, and ultimately achieve goal number 5, gender equality of the Sustainable Development Goals, women's voices must be at the center of any meaningful recovery strategy to enable this lived experience to move beyond just being a powerful story, but actually affecting real change. The choices we make today will affect the lives of women for decades to come. There needs to be commitment to a proportionate long-term response and the early involvement of minoritized communities in designing solutions. All sectors and public institutions need to acknowledge the unprecedented social economic impact of COVID-19 on the economic status of racialized communities, particularly women, and build in short, medium, and long-term proportionate policy and investment proposal, given that the impact of coronavirus has widened and deepened existing patterns of racial inequality. Economic interventions and solutions should be designed with the earliest engagement and dialogue with communities, specifically women, to bring the broad and close understanding of being at the sharpest end of COVID-19 to what can work at a practical level to remove barriers and revive economic activity. Thank you.